Hi, my name is Carl Freeman. I'm a student nurse at Miles Community College. Today I will be demonstrating how to apply a piggyback to an IV bag. First thing to go through are the 6 rights of medication administration. You have right patient, right drug, right route, right dose, right time, and right documentation. Next thing that we do is we go over the MAR and the physician orders. The physician orders state to administer chloroform, 560 milligrams IV piggyback every 8 hours, place in 50 milliliters of 0.9 saline, and infuse over 45 minutes. We've decided the drop factor according to the bag is 10 milliliters per that 45 minutes will be 50 milliliters, and drops a minute will be 11.11, which brings us to 2.8 drops per 15 seconds. All the information matches the MAR. Our first step is to perform hand hygiene and place gloves. We're going to determine that the dosage is appropriate for the patient, which we already have. And we've got all our supplies right here. Our next step is to open our 50 milliliter 0.9% sodium chloride. We're going to lower our IV bag. We're going to open our tubing. Maybe. We're going to check our bag for any problems, make sure it's not expired. We have until August of 2019. We're going to place our medication added sticker on the piggyback. So that when we're not here, the next nurse or staff member will have the information. We're going to take our IV tubing. We're going to check it for any problems. We're going to pull the blue cap off of the piggyback bag. We're going to remove the cap off the spike, and without touching the spike, we're going to insert the spike into the bag. We're going to lock the IV piggyback. We're going to take alcohol. We're going to wipe the port, remove the cap, insert into the white port. And normally this would be hanging, but due to our supplies, we're going to pretend. All right, I'm going to take off my gloves and perform hand hygiene again and apply new gloves. We're going to prime our, if I can get these gloves on. We're going to prime this to be half filled, which is about right there. We're going to come in, we're going to check the patency of the IV already placed. We're going to make sure that that's all good. We're going to remove this. Well, actually, I got to set up my medication first. We need 560 milligrams of chloroform. So we're going to wipe the top of the we are going to remove our we're going to add air. We're going to inject the air, turn it upside down, and we're going to pull back till we get the proper amount of medication. You're going to recap the needle without touching. We are going to set our drop factor. To be sure that we have the appropriate amount. And our drop factor is going to be 2.8 drops per second per 15 seconds. So I'm going to look at the clock. Okay. We're going to take our alcohol wipe. We're going to clean the port. And we have it locked right now. We're going to inject our medication into the IV piggyback. We're going to remove it, and we're going to drop it in the sharps container. Our next step here is to document what we've done. We're going to come over to the MAR. We have given the medication appropriately. All right, our next step here is we're going to throw away our supplies here. When the infusion is complete, what we're going to do is we're going to reset up the IV. So we're going to start by closing our IV, or closing our clamp, removing the piggyback from the pole, we're going to reset up our main line. We're going to put our medication up, and we're going to reset our drop factor according to what you're going to, after the medication, you're going to reset the drop factor for the original IV solution. So you're going to want 6.9 to 7 drops per 15 seconds. And then you're going to document everything you've done, how the patient has handled the procedure, and the tools that you used. Thanks.